for more on the matter, we are now live with Indonesian Health Ministry vaccination spokesperson, Dr. Siti Nadia Tarmizi. Doctor, thank you so much for joining us today.
Good
Hello,
afternoon.
there you are. Doctor, let's get right into it. What is the driving factor that urges the Indonesian government to implement the HPV vaccine as a mandatory vaccine in its national immunization program? Can you tell us a little bit on that?
Yeah, I think because the burden of the disease, as we know that the cervical cancer in Indonesia among female, they are the most common type of cancer after the breast cancer. Last year, we identified like 36,000 new cases of cervical cancer. And out of that, 21,000 that's from this cancer. And we know that usually the cervical cancer was are identified as very in the late stages. But if we can detect in early stages, in fact, this cervical cancer can have a more good outcome, almost like 90%. But the chance when you found the cervical cancer in the late stadium, it will be only like less than 20%. So with this condition, and we know the effectiveness of the vaccine, that's why the government give the policy that we will start the HPV vaccine across national.
Mm-hmm. Could you elaborate more on how effective this vaccine is, Dr. Nadia Tarmizi?
Yeah, I think HPV vaccines works extremely well. Especially it has been start in many countries in 2006, and it has been decreased the infection like more than 80% among female teenagers between 14 and 19 years, and among 70% among women with 20 years. So it's already giving the advantage by reducing the number of cervical cancer. Especially when we start this vaccine early in 10 years old teenager female.
Doc, can you tell us about the mechanism of the vaccination drive? So how do the public register, and are you going to use Peduli Lindungi as a method of registration? Can you explain that to us?
Yeah, I think because this is the routine immunization for children, especially below than 10 years old. So currently, we will integrate the system to the what we call it the Peduli Lindungi, but it's still in the process because Peduli Lindungi is still addressing for COVID-19 mostly. So in order to cover this. How the system are working, we still in the process. But as this is a national program, it will start during the school child immunization month, or we call it the BIAS, that will start on August. So we will giving this vaccine to the children in grades 5 and 6 of the primary school or equivalent during the August month. So it will be free, and then we will deliver this vaccination to the school during the children are attending the school.
Okay, so can we talk about the requirements? What are the requirements for a free HPV vaccine shot?
Yeah, so this will be for a female who are in the grades 5 and 6 of the primary school. That's the first criteria. And the second one, of course, they should not be in the the female teenager is they are the school children are in the very good condition, which means they don't have like a fever, coughing, or even any symptom, for example. So we just need the female between grade 5 and 6 are in the good condition when they will have vaccination tomorrow on the day tomorrow.
Yeah, this is good. I mean, hearing that it will be applied to students, especially girls in grade 5 and 6. But sometimes there this dilemma in the parent side, whether it's safe enough to give the vaccination before they have menstruation. Maybe you could elaborate on that as well. And do you have also programs for older teenagers, like in the high school or middle high?
Yeah, I think the national program is will be only for 5 and 6 grade. So other this target, we will not yet provide the HPV vaccination among others group. Yeah, so we still have HPV vaccination, but of course it's like a private one. So you can access this vaccination to like hospital or private clinics that already provide private vaccination. But for the national program, since based on the recommendation of ITAGI, the National Immunization Committee, the best of HPV vaccine that we should provide is like among girls in 10 until 12 years old. So that's why we are aiming this vaccination targeted to this group. So outside of this target, currently we don't have yet the program.
Doc, since it's a national vaccination drive, you must have prepared lots and lots of doses to give out. So how many doses exactly do you have, and are you going to get more of it for the free vaccination?
Yeah, currently, yes. Yeah, currently we already calculate the number of the targets. Yeah, so the girls in the 6th and 5th grades is like almost like 853,000. So we already prepared the number of the HPV vaccine with this amount. And of course, like you mentioned, we need again to educate their parents, yeah, to allow their children to get this vaccination because of the high fatality of HPV, especially cervical cancer due to the HPV infection.
Now, Doc, one of the most deadliest types of cancer that attacks women is cervical cancer. When should one know about cervical screening, and when to get a cervical cancer vaccine?
Yeah, so I think the best time to get the best protection is providing the vaccination among this group, like we already said. But again, between when we have a condition, what we call it as sexual active, so it means that we always need to have screening every once a year, because the cervical cancer, the most issue or we know that the cervical cancer mostly because of the infection from human papillomavirus. So human papillomavirus can be infected when we have sexual active. Yeah. So it means it can be of course infect female and infect the male, but mainly because when they infect, they start to infect the female. Usually, there is no symptom. So that's why the screening is really needed for active sexual female.
So we would also like to know if there are any side effects of these vaccines that people need to anticipate or need to know before they get injected, especially among the young girls.
Yeah, I mentioned that the HPV vaccine is very safe. It has been started in I think 2006 in many countries. Yeah, and yeah, currently there is very small side effect reported from other country, and it's and we can see is usually the related symptom because of the study showing there is no very severe side effect. Usually, it's only because of even like a fever is not reported. Yeah, usually it's only that. Uh, the pain, yeah, the swellness, something like that, that has been reported. So very mild side effect that has been reported.
All right, Ibu Dr. Siti Nadia Tarmizi, thank you so much for your information here and 3-Hour News Show regarding the program for free vaccination of HPV among female children here in Indonesia. Thank you so much.